Good morning, everyone, and welcome to M.P Shah Hospital. Today, for this very special occasion for us, I'm Dr. Vishal Patel. I'm the medical director here at M.P Shah Hospital. And I'd like to welcome each and every one of you for taking your time out, your precious time out today to join us for this launch of our comprehensive infectious diseases clinic and travel medicine center. With me today, I have Dr. Shamsa Ahmed, who is our head of the Comprehensive Infectious Disease Clinic and a consultant physician and head of our COVID unit, who has been heading and running that COVID unit ever since we started it. Dr. Shamsa.
Morning, Dr. Vishal. Morning to everybody who's logging in, and welcome to this really exciting and important occasion that we've got going on today.
So in most traditions, we normally have any special day or do something special or new that we are starting on an auspicious day. And we're glad that we're doing this today, which is the World TB Day, World Tuberculosis Day. And we wanted to make sure that something as important as this happens to coincide and be launched on a day where, on a very important day for the world in terms of World Tuberculosis Day. We will talk about that more later. But before that, starting any occasion, we would want to start it with a word of prayer and give thanks to the Almighty. So I kindly invite Mrs. Shaina Shah, our head of non-medical MMD, to take us through an invocation prayer. Shaina, unmute. Shaina, you're on mute. Kindly unmute your mic, please. Okay, perhaps as you're sorting out that technical difficulty, maybe we can have Sister Maran Chunga. She's also supposed to take us through an invocation and prayer. Sister Chunga, if you are ready, we can start off with yours. Shaina, let us know if you are if you have managed to connect and are unmuted. Okay, apologies for that, for all of you joining us. We will have that shortly. Meanwhile, what I'd like to do is once again welcome everyone and tell everyone why we are doing this. Communicable diseases have been very, very prevalent, especially in a continent like Africa where we are, and they normally form a big chunk of all the morbidity, mortality burden that we have for our patients and our population. There has been a switch, or rather there has been a bit of change in terms of communicable versus non-communicable disease patterns that we are seeing. Majority of the diseases we now see are still communicable, but the non-communicable diseases are also increasing. With that and a lot of research funding going into prevention of those as well, at some point communicable diseases were sort of being left out, or rather being not being given as much importance by some sectors, but they have come with a resurgence. I think TB is there, tuberculosis is there and is resurging, and there has been a lot of promise from the world over to try and curb this and control the disease. However, the pandemic has taken us a big step backwards, and has made us realize that communicable diseases have a much taller burden than people still anticipate. And we are also forgetting to focus on some of the more other communicable diseases apart from highly contagious ones like the COVID pandemic we're facing right now. With this in mind, we decided here at Amphisha that we want to make sure our clients get a holistic care when they have these infectious diseases. They get a continuum of care, because let's remember, it's not that anyone with any other disease like oncological diseases, cancers, high blood pressure, high diabetes or sugar problems, that will not get communicable diseases. They all get communicable diseases, and unfortunately the outcomes in them can be much worse due to their underlying comorbid conditions. So with this in mind, that is why we had decided on making sure we have a comprehensive infectious disease clinic, which Dr. Shamsa will speak about much later. Having said that, once again, a very warm welcome to all of you. And I would now like to invite our matron, Sister Chunga, our Director of Nursing. I think she's managed to sort out the technical issues, and she'll take us through. Sister Chunga.
Good morning, everyone. Thank you very much, team, Dr. Vishal, and our board members, as well as our leaders at the M.P Shah Hospital. May we be present in God. May we have our prayer for the launch. Our God Almighty, we thank you for this day. We thank you for bringing us together. We thank you for our leadership that has made it possible for us to have this launch. Almighty God, we place everything into thy hands. We thank and believe that through this launch, we'll be able to serve humanity. We appreciate you because you have made it possible, oh God. We thank you for this victory because you have made a wonderful day, and a wonderful journey is beginning today in our hospital as we launch our comprehensive infectious diseases center. It will go a long way to help humanity with regard to wellness and health. We pray, God, that you will guide us, you will work through the hands of medical team, you will bless the center, and you will bless M.P Shah Hospital fraternity. One God, we pray forever and ever. Amen. Thank you.
Thank you, Sister Chunga. And as you said, we need the strength. We need the strength day in, day out to keep fighting, to keep taking care of our patients. And I'm sure we are setting off on the right foot today. With that, I'd now like to invite our CEO, Dr. Tosif Din, who will give us some opening remarks about our comprehensive infectious disease clinic.
Thank you, Dr. Vishal. I hope you can hear me. Can you hear me, Dr. Vishal?
Yes, we can hear you.
Okay, good. Thank you very much, and a very warm welcome to everyone. We begin by the word of the great Lord, who has brought this beautiful day among us, especially amidst this pandemic, when we are all tested mentally, physically, emotionally, and for some even financially. But God has blessed us today, that today we are putting another feather in M.P Shah Hospital's cap by opening up our unit, the Comprehensive Infectious Disease Clinic, and the entire Travel Medical Center. So we really thank God for this. We welcome our board chairman, Dr. Manoj Shah, our various board members, the management to this day, and we thank them for their presence and their support throughout the pandemic, and even today as we put one more feather in our cap. The clinic, as you'll all phenomenal difference in the lives of our patients. And at this moment in time, I'd like to congratulate not only our medical director, Dr. Vishal Patel, the entire team, but in particular, Dr. Shamsa Ahmed, who has been ably handling and heading our entire infectious disease program and the entire COVID-19 platform. She has made a tremendous difference in the lives of patients, and I'm pleased to inform you that our patient outcomes have been more than our expectations. And we're forever indebted to her, her team, and the entire spectrum of nurses who have been able to lead us through. Today, 24th of March, marks the World TB Day with a theme coined "The Clock is Ticking." This theme is very interesting because indeed it gives us all time to think and say we don't have much time on our hand and we need to make differences as leaders in our own fields to see the difference that we can make into the lives of our patients. TB remains one of the world's deadliest infectious killers, and if you look at closer to home, it is one of the major causes of morbidity and mortality in Kenya. Statistics that we read show that TB affects age groups mainly from 15 to 44 years. And the major factor responsible for large TB disease burden in Kenya is the concurrent HIV pandemic. Today, as we reflect on this day, we are amidst a very, very difficult time for Kenyans, the COVID-19 pandemic. And I would say that this goes in well with the entire theme of patient care experience. And we're thankful that it's happening now more than ever before. With this, I'd like to say a very big thank you to everyone who has joined in. And with God's blessings, today we are going to be opening up this comprehensive infectious disease clinic along with our travel medicine center. May God be with us during this time. And once again, thank you for your attention.
Thank you so much, Dr. Din, for those opening remarks. And indeed, TB is a huge burden, and services like this and partnerships like this that we have between public and private sector help in making sure that everyone plays their part and do our best in reducing the TB burden. Next, I'd like to welcome and introduce our chairman of the Board of Governors at M.P Shah Hospital, Dr. Manoj Shah. And I think I'd like to, before I go to that, I'd like to thank our CEO, not just for the opening remarks, but also for the support that she has given us with this platform, with this initiative and launching this service. I know she gets her inspiration from our chairman, who always has given everyone the support for initiating any new services which help reduce any disease burden, whether it affects the affluent, whether it affects any other population. We have always had tremendous support in making sure that we are here at Amphisha, we're coming up with services that reach out and help as many Kenyans as possible. So Dr. Manoj Shah, I'd like to welcome you.
Thank you very much, Dr. Vishal. A very good morning to all our viewers. And on behalf of the Board of Management and Board of Governors of the M.P Shah Hospital, I wish to warmly welcome each and every one of you to this auspicious launch of our CIDC Center. Today is a very, very good and auspicious day as the whole world is celebrating with us the World TB Day. And the theme of this TB Day is "The Clock is Ticking." And what we have seen in the last 14 months with the current ongoing pandemic, we can only imagine and visualize the impact of how the clock is ticking in order to save lives of many. And when we talk about celebrating of the World TB Day and the theme for the World TB Day, the clock is ticking, it is very, very important for all of us, especially in the medical field, for action to be taken. On the other hand, it's also a very exciting day for the M.P Shah Hospital as we launch the comprehensive infectious disease clinic and the travel vaccination center at the M.P Shah Hospital. This center, like our previous speakers have mentioned, I believe will greatly enhance service delivery, not only to TB patients, but other communicable diseases that we have in our country. A very good example of that is the current ongoing pandemic. On behalf of the board, I can only assure you that our CEO, Dr. Tosifdin, our medical director, Dr. Vishal, have put up a very competent team led by Dr. Shamsha Ahmed to look after and manage our CIDC center at the hospital. I am also very optimistic that this center now will benefit many and also provide competent and holistic service to all. On this auspicious day, on behalf of the board, I wish our CIDC and Travel Vaccination Center all the very best at the M.P Shah Hospital. A very good morning to all of you, and thank you for your patient listening. Back to you, Dr. Vishal.
Thank you so much, Dr. Manoj. And thank you for leading us and providing us with the support that we require and pushing everyone, each and every one of us to provide the best that we can for our patients. And now we get to the most exciting part of today's important occasion. We are launching our clinic. We are launching our comprehensive infectious diseases clinic and our travel medicine center. We would have, of course, loved to invite our patients, our staff to join us in this session, have them have a look at the unit, have them ask questions. However, we are right now amid the pandemic and the third wave of the pandemic in Kenya. Hence, we have to do this virtually, and apologies for that, but I'm sure everyone will understand why we have to do it this way. So over to our media team now. We will have a virtual launch, a countdown and a virtual launch, and then we will have followed by that, we'll have an introductory video on comprehensive infectious diseases clinic.
My name is Dr. Shamsa Ahmed, and on behalf of the M.P Shah Hospital, I'm proud to present the one-of-a-kind Infectious Disease Clinic and Travel Medicine Center opening at the KPJ Towers Specialty Clinic's first floor. This is a first of its kind for M.P Shah. Experience working with USAID and setting up HIV/TB centers as well as sexually transmitted disease clinics in northeastern Kenya, what we discovered is what people needed was a one-stop center, comprehensive care clinic, meaning we have a nutrition service, we have the counseling services, we have the pharmacy, we have the laboratory, we have all the clinical services, inpatient and outpatient. So we provide a continuum of care. Whether you're at home, whether you're here, you have a full package of care for those kinds of patients. As much as the focus has been on non-communicable diseases like diabetes and hypertension, we have to understand that infectious disease still carries a very high burden on our population and is a high factor for mortality in patients who even have diseases such as diabetes and hypertension. So you need to have a clinic where you have a chronic care model, people to follow you up with the diseases when they start off and to take you through that journey, because a lot of things, as you've seen, like HIV and TB, are things that we might not have a cure currently, but these are things that can be managed and can be controlled. This one-of-a-kind clinic opening at M.P Shah aims to offer a one-stop shop for many patients who so far have not been able to access these services within our institution. We'll be looking at setting up an HIV, TB clinic, a hepatitis clinic, a COVID clinic that also offers home-based care as well as post-COVID follow-up, and a travel medicine center that deals with all the vaccinations that would be necessary for any kind of travel.
Thank you so much, and congratulations to all our teams and everyone who's part of this hospital, all our patients, everyone. Congratulations to Dr. Shamsa, especially the head of the clinic. I'm sure she's been waiting eagerly for us to give her this platform and make sure that we start off with the service. We have been providing the service, but now at least we officially have a name for it. Thank you, everyone. And now I'd like to let her take us through the whole journey, to let her tell us more about her baby, this unit, so that we can then understand better before we can talk a bit more about tuberculosis. Thank you.
Thank you, Dr. Vishal. So I'd like to welcome everyone. Like you said, this is my baby, so we're quite excited today. I'd like to acknowledge the presence of the chairman, our CEO, yourself, all the senior health management team, the board members. There's presence from Ministry of Health and county officials. Without that support, we wouldn't be where we are today. So welcome everyone to our virtual, socially distanced, COVID-compliant launch. I think we've gone through this a little bit, but it's fitting that World TB Day with the theme, The Clock is Ticking, is the day that we're choosing for the launch of our Comprehensive Infectious Diseases Clinic and Travel Medicine Center. The theme is The Clock is Ticking. If there's one thing this past year has taught us, is that we do not always have the luxury of time. And no matter the circumstance, if we want to achieve a desired goal, then we need to focus all our efforts. This clinic has been a long time coming, and it's a huge and important moment for our institution. Our desired goal was the creation of a one-stop shop for all our clients and their families to be able to receive first-class treatment, psychosocial support, and help erase the stigma associated with infectious diseases. Since the first case of HIV was detected in Kenya in 1984, we now have approximately 1.5 million Kenyans living with HIV. We walked through a time of stigma and silence to now in 2021, where we have affordable treatments, we have effective programs, whether they're in public healthcare and private healthcare. And we understand that now at least we have 96% of people living with HIV who are aware of their status and on treatment, and more than 90% are actually virally suppressed. We also know that TB is not always a disease of people who have low immunity, but are actually found in young, healthy individuals living in urban areas. As for COVID, I think at this point we all feel the weight of that. It is these statistics that have helped us plan and create this kind of a clinic, understand the burden in our society, and guide us on the need for response. Over the last year, we managed to build and provide these services. It might have been a little bit more quiet, maybe in the background of the pandemic, because our clinic also served as the center dealing with this pandemic. But today, we need to be loud. We need to be the voices of those who haven't been able to be heard, and we need to let them know that there is a place for them. So we're going to move away from whispering about HIV and TB and hepatitis and sexually transmitted diseases and COVID, and we are embracing positive living in all aspects. So the clock is ticking. The clock is ticking for us to reinforce all that we've learned before. The clock is ticking as we find new ways to combat these diseases. The clock is ticking as that we remember that any patient with any condition could be our friend, our co-worker, our family, and a lot of times that patient is actually ourselves. And we deserve dignity, respect, and the right to quality healthcare. We are grateful for the presence of our partners from Ministry of Health and County and various stakeholders, because without their effort, we are not able to expand this aspect of healthcare and encompass a larger community in our area. When we look at travel medicine, because medicine isn't always about illness, the global village that we live in now, with that ease of travel, obviously comes more questions. What vaccination do I need? What do I need to carry? Do I need travel insurance? What happens if I fall sick abroad? If I need to come to Kenya for treatment, understanding that Kenya is essentially the center of East and Central Africa. We are a forefront in healthcare. If you're going to be coming here to M.P Shah from another country, what is it that you need to know? If you do need to seek services outside, what is it that you need to know? What vaccines, what immunizations do I need? All of these questions, all the answers will be found within this center. So it is my baby, it is our baby. We're really proud, we're really excited. It's taken us time to get here, but I think on World TB Day, it's with immense joy and pride and with the support of a lot of people in this institution that we can say we're going to launch our CIDC, which is a Comprehensive Infectious Disease Center and Travel Medicine Center today. So I think maybe what we'll do is we'll hand over back to Dr. Vishal. Now, I know it's a virtual meeting, but I'll be hoping that maybe we'll be sent some real-time snacks and cakes to cut later on. Obviously, socially distanced and COVID compliant. Dr. Vishal?
Indeed, this calls for some mini celebration with any cakes or sweets, but as we said, it will have to be COVID compliant. So we're still waiting for the application to go through. On a lighter note, thank you so much. And indeed, yes, the burden is there. It is increasing, and as Dr. Shamsa has pointed out, you can see the importance of having a facility and a service that can cater to these patients. Next, I'd like to introduce and welcome Elizabeth Muanywambo, who is the head of division of communicable diseases and head of the TB program at Nairobi Metropolitan Services, to tell us a bit more about the World TB Day and how we are also looking at making sure that this clinic works hand in hand with the public sector as well, to make sure we can provide the most for Kenyans.
Okay, thank you very much, the management of M.P Shah Hospital. Sorry, I'm logging on the way to the studio, but I'm grateful for this milestone on having a full infectious disease unit at M.P Shah Hospital. TB is a great public health concern globally, as 10 million people fall ill with the disease every year, and Kenya still remains among the 30 high TB burden countries, with TB being the fourth leading cause of death in Kenya. Kenya has estimated 140,000 people with TB, although we are missing 40% of the TB cases annually, and the private sector in Kenya account for 48% of the health facilities, with urban counties having even higher facilities from the private. In Nairobi alone, we have 64% of facilities being the private sector facilities. So we are very grateful. And also 42%, according to the patient survey that we did in 2016, the patient with TB symptoms assess initial treatment at the private sector. So we cannot attain the global and the national TB target if all healthcare providers, including those in the private sector, are not adequately engaged. WHO recognizing the private-public mix as a strategic initiative that needs to be scaled up in order to end TB in the world come 2035. Engaging the private sector is so paramount in ensuring that no TB case go undetected and untreated. The National TB Program, together with the Nairobi Metropolitan Services, are committed to support private facilities in TB activities by ensuring provide sensitization and training on TB, disseminate new policies and guidelines of TB, provide reporting and recording tools of TB, even link facilities with gene expert site to enable access of newer and more sensitive diagnostic tests. We also going to provide anti-TB medicine for free and also ensure continuous mentorship and support supervision is provided to these facilities. This is indeed to ensure that all people living with TB are timely and adequately diagnosed with TB and initiated on effective treatment and care given to the patient according to the international standard of TB care. We are excited today to be part of this launch of M.P Shah, and this is a big step toward ensuring that TB screening, diagnosis, and management will be prioritized and given the attention it deserves. So as we mark World TB Day today, we are reminded that the clock is ticking. It is time to end TB in Kenya. The NMS and TB implementing partner in Nairobi, we pledge in commitment to support M.P Shah Hospital as we work together towards attaining a world free of TB by 2035. So we are very grateful. Thank you so much. We are happy with this milestone at M.P Shah. As NMS, we are here to support you, and we are going to work together to ensure that we achieve the goal of ensuring world TB free generation. So thank you, and back to you.
Thank you so much, Elizabeth. And indeed, as you've said, and everyone else before you have said, that clock is ticking. We do have a lot of work to do, and we do appreciate all the support that we receive from the authorities, from NMS, from MOH. And we do appreciate that all the efforts that are being put into the prevention of tuberculosis. M.P Shah has always been involved, and not just being involved, but we are also involved in a way where we are asked on how we can improve these services and prevention, promotion and treatment. And we also do look forward to continuing with this partnership. Next, we will move on to just a short video on further information of the Comprehensive Infectious Diseases Clinic by one of our nurses in the clinic, Sister Lillian Omondi.
Hello viewers, my name is Lillian Omondi, a nurse at Specialty Clinic, M.P Shah Hospital, and today we are going to speak about Comprehensive Infectious Diseases Clinic at our hospital. When we talk of infectious diseases, these are diseases that are caused by living organisms, viruses, and bacteria. And these are diseases that can be passed from one person to another. The main ones that we deal with at M.P Shah Hospital in our clinic are HIV, hepatitis B, and tuberculosis. Now, when we talk of tuberculosis, tuberculosis is a disease that we can get from others when we share the same room, because it is a disease that we get by droplet. TB can be prevented by getting vaccines. So when we talk of comprehensive care in our clinic, it is you can get the care under the same roof. When you come in, you can get consultation, you can get your vaccines, you'll get your medications, you'll be counseled by our psychologist, and at the same time by our nutritionist. If you are sent to the laboratory, we have a laboratory within the same setup, and we also have our pharmacy within the same setup. When we talk of having these diseases taken care of, I want to give a testimonial of having our TB patients who are compliant to treatment, having been cured completely. They are with you in the society, leading their lives as each and every other person. How often do you have to see the doctor? For the TB patients, especially those who have TB of the pulmonary, we require you to do a test 2 months after you start your treatment, 5 months when you're on the treatment, and the last test you do when you finish your treatment, and that is when now we will say that you have been cured of the disease. In my experience as a nurse, I have seen so many patients. At the initial stages, we find there is a lot of denial, a lot of fear that they will be stigmatized where they live, where they work, in the community. But after coming, getting counseling, getting health education, starting their medication, in fact, most of them are the ones who are now educating others in their community and in their working places. And we have seen the turnout of even these people who are coming just to know their status increasing in number.
Thank you so much, Sister Lilian Omondi, and a very important message indeed for our patients from a person who has been dealing with this and has been assisting these patients to go through that journey. And we hope that she keeps doing that. We hope that she keeps training other people as well, which she does, so that we can keep having more and more of our healthcare workers becoming more aware of how to take our patients through these difficult journeys. Next, I'd like to introduce Dr. Jacqueline Kisia. She's from the Ministry of Health with the Respiratory Diseases Department. And we would like to thank the Ministry of Health to be in their support so far as well in that they have accorded in especially the pandemic and combating other communicable diseases. So Dr. Jacqueline, would like to hand it over to you to give us a message as well from the Ministry of Health.
Good morning. Can everyone hear me?
And
Can you hear me?
yes, we can.
Okay. I would like to first introduce myself. My name is Dr. Jackie Kisia from the National TB Program. I do coordinate the care and treatment in the TB program under Ministry of Health. The CEO of M.P Shah Hospital, Dr. Tosin, and all protocol observed. The Ministry of Health congratulates the M.P Shah Hospital for this auspicious occasion for an inauguration of the Infectious Disease Center. This wouldn't have come to a better time than this when we are struggling with the infectious disease pandemic. Notably, in our country, it has continuously bared a brand of the infectious disease. In this current moment, we are in the middle of the third wave of the coronavirus disease, which continuously ravaged the humanitarian and causing a lot of misery and death. Our country has faced other infectious disease pandemics such as tuberculosis, malaria, TB, and diarrhea disease. But today I will talk about TB since it's today is World TB Day on the 24th of March. And I want to take this opportunity to talk about the infectious disease, which is tuberculosis. TB is a major public health problem in Kenya, and it's the fourth cause of death among the infectious disease. Kenya is listed as the 30 high burden country for TB in the World WHO 2017 report, that is in TB, HIV, and drug-resistant TB. The burden of TB in Kenya, the prevalence study, which was done last, showed 426 cases in each 100,000 population. 40% of these cases remain undetected and untreated. The people who are mostly affected by TB are males, more in the urban area, and surprisingly, 83% are HIV negative. TB causes 3 to 4 deaths every hour. So we lose 3 to 4 patients every hour. Cases which were detected in 2019 are 86,000 cases, and 9% of these cases are pediatrics. Treatment of TB is very expensive. And for example, treating a patient with drug-resistant TB will cost around 70,000 during this duration. And for drug-resistant TB, it can go up to 1 million shillings. TB is curable if detected early and diagnosed and treated. The Ministry of Health, in conjunction with other partners, the private sector, are working together and putting structures in place by training healthcare workers in the private sector and also in the public sector. The Ministry of Health is also providing the diagnosis machines by providing selected facilities with gene expert machines, cartridges, and also Falcon tubes. We also provide TB treatment for free, and this extends also to the private sector. During the treatment period, the Ministry of Health also provides social support by providing at least a bit of stipend to the patient during the time they're going through the treatment, by providing a bit of finances to help the patient cater for transport and also nutrition. The Ministry of Health is totally committed to fight TB and to eradicate TB by 2030. Our slogan is find, treat, and cure all TB cases. And our motto is to Pimwa TB, Tibiwa Ishipo. So together with our partners, it's everybody's responsibility to fight and to fight TB and make sure we create awareness Is it the church? Is it the private sector? Is it the schools? We all have to come together and fight TB. Thank you. And this is our motto as a Ministry of Health. Thank you.
Thank you so much. Thank you so much, Dr. Kisia, and the Ministry of Health for that message and the support so far. And I think before we move ahead, I'd just like to take this opportunity with Dr. Shamsa to thank some of our supporters who have sent in congratulatory messages. Thank you so much. And perhaps as we are acknowledging them, Dr. Shamsa, what message would we like to give them in terms of not just World TB Day in terms of tuberculosis, but also another message to give them to deal with the current issue in terms of we have the pandemic, we have other infectious diseases there. Most people are grappling with economic hardships as well in this. So at this point in time, what message do you have for those who are suffering from chronic infectious diseases?
I mean, even as we look at the comments on Facebook, we've got a lot of people saying congratulations, you know, they're excited that we have this service. I can see there's someone called Eve Gal, Mumbi, Gitonga. I think if you look at all these messages, it just shows how timely and how necessary a clinic like this is. When I was listening to the head of the TB program talking, I was thinking back, like when I was working in Northeastern and we were managing patients with TB, it sounds very easy to say, okay, you have a disease, go and take these tablets. But if you're not looking at a patient holistically and things that they're talking about, giving patients stipends, making sure that psychologically they're supported, we're not treating a disease, we're always treating an individual. So whether that's HIV, TB, or even COVID, which is on everybody's mind, we have to remember not to lose sight of the patient and the person and their family, and not just focus on a disease and a treatment modality. I mean, if we're going to go back to COVID, we're going to go back to the fundamentals. We need to continue wearing our masks, washing our hands, socially distancing. And for those who can get the vaccine, if it is available to you, please get the vaccine. Like, let's not get lost in a lot of, you know, disinformation, all these strange stories we're hearing. Remember that even in the time when HIV was first diagnosed, and we had a lot of the same kind of stigma and stories, and it took a lot for us to break through that to get to a point where, you know, there is medication, you can take it, you can continue your life as normal. So I think what our take-home message needs to be that we are here as a facility. We have this function. It's not that we've never had it, it's just now we have rebranded, re-strategized, and we're trying to bring it out as holistically as possible. So as a facility, we are here, we have everything ready for people, medically, psychosocially. So I think what everyone needs to do is just reach out and, you know, let this baby now become a toddler and start walking, and like let us get into the actual work of what we need to do now.
Yes, indeed. And I think that's one very strong message. Let people not suffer in isolation. They need to come and get help from where medical assistance is available. And I think a very important message to all Kenyans, all citizens, those who have been identified by the government, by the ministry to be the at-risk or the highest population that they've identified currently as healthcare workers, uniformed officers, the teachers, the clergy. They should make use of this opportunity and get their vaccines. And I think all, as you rightfully said, all citizens also, we do have a social responsibility as well to follow all the protocols that have been laid out. And thank you for that. I think perhaps maybe if you could just elaborate just a bit more on the travel medicine side of it, what we are thinking about. As you said, some of these services were available before, but maybe in isolation, not packaged together. So how have we rebranded? How are we trying to help someone with that?
So when you're looking at travel medicine, I mean, it's a field that's been there for a while, but it's always been in broken pieces. For instance, if I need to travel, like a lot of people need to go to India, we know that you need a polio vaccine. It would be word of mouth, you need a vaccine. What date should I get it? How long do I need it before I travel? And you kind of walk into any vaccination center, and then you're overwhelmed with information. So the purpose of the Travel Medicine Center is, one, to look at where you're going, what are your contingency plans, do you have enough information? So you see, one, we've created a little booklet for you to let you know if you're going to certain areas, like you might not consider certain countries high risk, but every country has some infection or some kind of illness endemic to it. So if you need a vaccine for it, we can guide you on that. Travel medicine isn't only about people traveling, but even our high-risk patients. Like if you're diabetic, if you're a kidney patient, if you're on cancer treatment, ideally there are vaccinations that you should be getting on a certain schedule. So we work with your primary physician, even if you're from an external facility, to make sure that you're getting those vaccinations on time. We have something called a travel medicine kit. Now, all of us know when you need to travel, we have that little hassle of, oh, do I have Panadol? Do I have this? Do I have that? And you have to kind of create your own package. So what we've done is we've already come up with those packages for you, a basic package for what you would need, even if you were traveling just from here to Mombasa or Kisumu for the weekend, or something when you're traveling abroad. If you're going abroad and you are on chronic medication, you have to have prescriptions to travel. You can't just be carrying all these medication. That's what happens to people most of the time. They get stopped at our airport or that international airport. So as long as you're one of our patients, we give you those verification documents. Certain people are not supposed to get certain vaccines. So you might have to go to a country and they want you, or they expect you to get a vaccine for the visa. So the Travel Medicine Center also gives you those exemption letters to explain why you as a particular individual, maybe because of your age or any underlying issue, why you shouldn't be getting that vaccine. We work with even medical insurance and medical travel travel companies to help you have travel insurance as you're going there. So if you go to another country and you fall sick, you have your link with your doctor here who can then deal with the medical services there, see how to get you back here. One thing I've said is, Kenya is the center of medicine in this area. A lot of people come to Kenya. And as our hospital is also growing and we're moving into things like stem cell transplant, you're going to find a lot of people are going to be coming to Kenya. So what we need is to be able to assist them to travel this way and know that whatever other issues they have, we will still be able to manage them, not just the immediate treatment that they're coming from. So it's a very holistic concept.
Thank you for that explanation, and I'm sure that has helped most of our viewers and followers on today's forum. And I'd just like to congratulate you once more. And I know the work, as you said, has been ongoing, but now it will get even more. But I'm very confident that your team is up to the challenge, and all the best to all of you.
Really big thank you. We sat for a lot of meetings in your office many months ago, even before the word COVID was in Kenya. And we planned a lot of this with the help of a lot of people who are on the forum today. So I'm really happy that today we can be loud about it and help break the stigma that is prevalent within our communities and let them know that they can get quality first-class healthcare here.
Thank you so much for that. And I'd like now to invite our Deputy Medical Director, Dr. Joanne Osorombui, to take us through a vote of thanks.
Ladies and gentlemen, a very good morning to you all. It gives me great pleasure to give the vote of thanks. On behalf of M.P Shah and the entire M.P Shah community, appreciating our chairman of the board, our CEO, our medical director, director of nursing services, and all the M.P Shah staff, we'd like to extend a hearty vote of thanks to Dr. Elizabeth Mweni from Nairobi Metropolitan, and to Dr. Jacqueline Kisia on behalf of Dr. Elizabeth Onyango from the Ministry of Health. As M.P Shah, we are committed to watching the clock ticking and supporting all the efforts of our Ministry of Health to eliminate TB by 2030. And we just want to appreciate the partnership with both the county and the Ministry of Health through the free TB treatment, the monitoring and evaluation tools, and the support in building capacity to ensure that we give stellar care to our patients. We just like to also encourage those who are listening and tuning in that for those who fear to come to the hospital, Dr. Shamsuddin mentioned that there's also an opportunity for telemedicine for follow-up, just so that we do not have anyone falling off the bus. And as you heard from Sister Lillian, TB is curable. I'll say it in Swahili, TB inatiba. So thank you all for a good day, and we wish you a memorable World TB Day. Thank you very much. Back to you, Dr. Vishal.
Thank you so much, Dr. Sorombui, for that. And before we can conclude, I think it's our duty and it's only apt that we end again with a word of prayer and thanks. So I'd like to invite Shaina Shah to take us through a word of prayer.
Thank you, Dr. Vishal. Om Namo Arihantanam. Om Namo Siddhanam. Om Namo Ayarihanam. Om Namo Upajaranam. Namo Namo Sahulam. Eso Panchanamuha Savapranasa Mangalaraja Sarvesindu Padamam Pavai Mangalam Padamam Pavai Mangalam. Thank you.
Thank you so much, Shaina. And that concludes our program today. Thank you so much, everyone who joined in, and those who at least those who got to be a part of it. We will be sharing recordings of this later as well for those who missed out. And I wish all of you fruitful days and journey ahead. Let's remember a lot of work needs to be done. Let's stay safe. Let's observe all the protocols for COVID. Let's protect ourselves as well as our loved ones. Thank you so much.